So if you have a single lumen central line, what our goal is to have less entries as possible. So every single lumen central line is going to have a stop. It was going to be just for medications and lab draws, but then you're breaking into the system. So what we decided to do was put a bifuse where you're going to have your IV fluids and or TPN running, and then your med line will be attached to the other one. You can clamp it off when your med line's not in use and let your TPN run, and of course clamp it off when you do your lab draws. Or if your medication is not compatible with your TPN, you can clamp off your TPN and have your med line run through. So this whole section down to here is going to be changed every 3 days with line change day. And remember that your med line needs to be changed once every 24 hours on the morning time. So first you're going to gather all of your supplies. You're going to wash your hands. Again, we're going to be creating semi-sterile field, so mask goes on and gloves. You're going to grab the 3-way manifold and you're going to open it up and you're going to stay on this semi-sterile. This is port 2, this is port 3, and this is the end port. So when you look at it, you're going to want to put your flush on the end port. You're going to want to put your waste on port 3. Port 2, you can use it for your labs. And then for port 1, you can stick on a blood gas syringe. If you don't need a blood gas, you can just leave the cap on. But we'll put on a blood gas syringe. If you want to, you can flush through, or you can leave it. If you leave it, you will get an air bubble into your waste syringe. So when you give back your waste, you want to make sure you tap so that the air goes to the top. So you put this back into your semi-sterile field. You grab your 4x4 and your swab cap and your setup. And you move over to your patient. Your mask and gloves on. You're going to go to your patient. You're going to open up your 4x4 and place it under to create your semi-sterile field. And then you're going to turn your stopcock off to your patient's fluid. From there, you're going to take off the swab cap, and you're going to take your manifold that you just created, take off that cap, and you're going to connect the two. From there, what you're going to do, you're going to turn off to your flush, and you're going to pull your waste. Then you're going to go off. You're going to pull your sample, and then you go off and pull your. From there, you turn them off to your gas, off to your sample, get your air out, return your waste to your patient, turn it off, and then when you flush, you don't need to clear this, you just want to clear your line. So you flush until your line is clear. You disconnect. Make sure you hold on to your clear link so that it doesn't fall off. And then, with your new swab cap, you replace and make sure that it's off to there. And then you can restart your fluids. And then you have your samples.